everyone. Good morning and good afternoon, depending on where you're located. I hope everyone is doing great. Thank you so much for joining us this afternoon or this morning. We will be getting started very soon. There are individuals still in the process of connecting and logging on, so we're going to give them another minute so that they can continue that, and then we will officially start today's session on fostering health equity with CLAS, implementing the National CLAS Standards to reduce health disparities. Thank you, and your lines are all on mute, and they will continue to be, so we will be getting started soon. Thank you. Okay, I just have also a quick question. If you are sitting with a group of coworkers that are all participating on this webinar, but there's only one login, if you could please type something really quick, let us know in the chat box that you're joined with a group, and then after this webinar, we're gonna ask you who were the names of the individuals that were listening in and participating along with you if you were sitting together in a group. We would really appreciate it because we'd like to gather an accurate number of everybody who listened and participated in today's session. So we would greatly appreciate it. Just now, send us a quick text, in the chat box, letting us know. Thank you so much. Okay, we're going to get started with today's session. Thank you once again for joining us today to participate in our first session of Proceed NASA's summer webinar series. Today's session is entitled Fostering Health Equity with CLAS, Implementing the National CLAS Standards to Reduce Health Disparities. And we are really excited and happy that you were able to take off your schedule to join us today. I have some participant guidelines I want to just go over quickly. Again, as I stated a moment ago, all lines are placed on mute at the moment. We are recording today's session, so if you're interested in receiving the recording, please email us and we will send it to you. We will have 2 question and answer periods in today's session. one after our guest speaker presentation, and then one at the end of the session. But if you have questions, please, we encourage you to use the chat box so that you don't forget your question and that you can interact and provide us feedback and comments throughout the session. We would really appreciate it. First, let me say my name is Brenda Cruz, and I'm Manager of Training Services and Distance Learning here at Proceed's National Center for Training Support and Technical Assistance. And I'm here today with my colleague, Mr. Miguel Taveras, who is Program Manager, and we are both part of the CEBA for Health Equity Program, Capacity Building Assistance Program sponsored or funded through CDC. So we're, again, really happy that you have joined us here today. So these are today's learning objectives. I'm going to quickly read them. We're going to describe the basics of the National CLAS Standards. We're going to explain CLAS purpose and why it matters. We're going to discuss how organizations can use CLAS to foster health equity and reduce health disparities. And we're going to go over some tools and resources that can be used to evaluate the organization's CLAS implementation status and outline a feasible CLAS implementation plan. So these tools will help you do that. And how will we accomplish these learning objectives are through our very ambitious agenda that we have today. We're going through the introduction and welcome right now. Next segment, we'll talk about why health equity is critical. Following that, we'll talk about what is CLAS and why it matters and how to use CLAS. We have a guest speaker today. His name is Mr. Christian Mendez from the North Jersey Community Research Institute right here in Newark, New Jersey. So we're going to be speaking to him a little later. We're going to summarize things. We're going to give you an opportunity to ask Mr. Mendez and us any questions about our content. We're going to go over some tools, as I said, and we're going to discuss some of our upcoming events that we have planned. We want to remind you of our program hashtag, which is Proceed CEBA for Equity. If you enter it into our social media sites, it will take you directly to our program-specific postings, and you will also be able to access some of our resources and tools on our social media sites. So before we go any further, I do want to ask you just a couple of questions, just 3 quick questions that we want to ask you just to get to know who you are, where you're coming to us from, and we have another content question here for you as well. So our first question is, in which U.S. region is your organization located? Let us know, please. For those of you who are in a group situation participating, you can type it in the chat box. And also, please remember to just let me know that you are sitting and participating in a group, because I want to reach out to you so that you can give us the names of the individuals so that we can capture an accurate number of attendees and who participated. I just got a question. Is any training certificate going to be provided? No, but if you need a letter of participation or something like that for today's session, do not hesitate. Send me a quick email and we will be glad to create something for you. So just send me, Mr. Logo, send me a quick email. Okay, I'm going to close the poll today, and right now we're going to see where you are all contacting us from or participating from. So we have a nice mix. Wow. We have a number of you from the West Coast, 22% of you from the Midwest, South, Northeast, and Caribbean are pretty much all equal. So thank you so much. Well, I'm going to go ahead and do the next one. Okay, so what position title do you hold within your organization? Just to get a sense of the types of people that are participating in today's session. Okay. And we have a number of executive directors and deputy directors. We have a large portion of our attendees today are program directors or managers. We have some medical case managers, clinicians. And if you selected other, please let us know what positions do you hold. And we want to know how familiar you are with the National CLAS Standards. One more moment, and I'm going to close the poll. Here we are. Some of you are very familiar, but we do have people that seems like could definitely benefit from learning more, becoming more familiar, or aren't familiar at all. Perfect. We are so happy that you joined us, because hopefully by the end of today's session, you will be all over the Think Cultural Health website thinking about how you can implement the CLAS standards. So great. So keeping it moving, I'm going to continue, and I'm going to turn over the session now to our next speaker, which is our NASA Program Manager, Mr. Miguel Taveras. Miguel?
Oh, that feels so formal. I'm just right next to you, Brenda. So thank you so much, Brenda. We have been using the image that you have in front of you. Hopefully everybody is actually able to see it. And we've been using this image extensively because it captures the essence of what health equity means and how it's different from health equality. So as we move on, we'll get into what is health equity. And there are different definitions. You can find some of them online. One of my favorite ones actually states that health equity means that everyone has a fair and just opportunity to be as healthy as possible. And for that to happen, that requires that we tackle obstacles to health, such as poverty, discrimination, and the consequences, and including powerlessness and lack of access to good jobs with fair pay, quality education and housing, safe environments, and healthcare. So let me show you what that looks like actually. How do we get to health equity? And in order for us to do that, we might be tempted to think that it's all about good quality, affordable healthcare, but that's actually just one of the 8 crucial elements. If you look closely, you'll see that in order to actually achieve a state of health equity, we need to tackle all of these different elements. Because if we take care of, for instance, quality, affordable healthcare, but forget about the other 7, we are really not promoting health equity. Now, let's continue to the next slide real quick here. And we can talk about health equity in an abstract fashion. The reason why we're talking about this is because we have terrible health disparities in America. And I will try to summarize that and show you the big picture. So when we talk about health disparities, which is one thing that we need to tackle in order to reach health equity, we usually look at 2 particular indicators. The first 2, and I'm going to share with you in the next slide, the first one has to do with life expectancy. So this would be the scorecard for the United States when it comes to health equity, but in terms of infant mortality, which is the first indicator we're going to look over. If you look at that, first of all, the United States spends about double that wealthy comparable nations spend on healthcare. But if overall, we rank number 43 out of all the countries that report information on infant mortality rates. And if you look at inside the United States, when the overall infant mortality rate would be around 7%, if you look at different groups, right away you will notice how health disparities emerge. Because in an ideal world, everybody would have the same access to health services. And when you look at this, you'll see that some groups in particular have 2 and even 3 times a higher infant mortality rate than others. But infant mortality rate is not the only issue we need to take a look at. And we're going to go into the second element, and that's life expectancy. And life expectancy for the entire country, in an ideal world, again, we are ranked number 28. Keep in mind that we spend double of what other countries spend on healthcare, and we rank number 28 out of 223 nations. But if you look inside the United States, not every group is reaching that national average. And in particular, if you look at the African Americans, for instance, they happen to have a 12.4-year gap from Asian Americans who pertain to the group that's living the longest. Now, let's go to the next slide so that I can show something closer to home. But then again, it's easy to talk about countries. It's easy to look at these numbers. Actually, my son is always looking online for who lives the longer, which country has the oldest population, and things like that. But let's take a look at our nation's capital, which is representative. It's right in our backyard. And when we talk about life expectancy, like I said, we usually do so in terms of countries. Let's take a look inside of the United States. And the Center for Society and Health at VCU has put out several of these infographics. Now, what may jump at you if you take a look inside of Washington, D.C., is that within 4 or 5 miles from each other, people who are living in the area of Georgetown reach 94 years of age, whereas people just 4 or 5 miles away at Trinidad, they die on average at the age of 67. That's a 27-year-old gap, which it's really difficult to just see this and not ask what, remember, health equity is all about. Are we giving everybody in this particular city the same access to quality health, good jobs, and the other 7 elements I told you about? So that's what health equity is about, and that's why we need to pay attention, because the disparities are enormous. Just like I'm sharing this one with you, they have online about a number of other cities. And let's take another step and look at the big picture of disparities in the United States. And I could have spent a few minutes or the rest of the session, I talked too much sometimes, showing you statistics about disparities. But if I were to summarize that, by the way, you're not meant to see the little numbers there. That's just to show you that if you take away one minority in particular, one minority group, if you take away Asian Americans, in every single area that we look at, minorities, let's say, for instance, in terms of new diabetes cases, we're going to look at minority groups accounting for 2 to 3 times more new cases than the majority of the country. If we take a look at, for instance, death from strokes, you'll see that African Americans are 44% more likely to die of stroke than the rest of the population. And these disparities are really personal, because when I look at them, for instance, if I talk to you about, I was saying about the African American population, I have to put a face to those numbers. And I see one of my very best friends who happens to be African American, and I think this is not all right. Or if we look at, for instance, the fact that if you look at new HIV rates, that people of color, young people of color, account for up to 73% of all the new cases. And we realize that the disparities require our attention. And I know you are people of action, and you're wondering, but what can we do about it? And first of all, you took a step and you're here with us today. And let's move on to part of that solution. So here at Prosit NASTA, this new program, which we're going to share information with you about, we are not staying on the sidelines. We really want to actually do something about addressing those sad and horrific health disparities. And what we want to do in terms of health disparities is to build the capacity of leaders and staff within community-based healthcare settings to identify and address inequalities. And also, this would happen at the organizational and the community level as well. We want to achieve that goal through targeted training, technical assistance, information transfer such as this one, and peer exchange. If we move on, I'll tell you a little bit about the menu of strategies that we have. But today in particular, this day is all about one of those strategies. And it's about operationalizing the adoption of the National Standard for Culturally and Linguistically Appropriate Services, also known as CLAS. So today is all about that and how CLAS provides us with a strategy and a blueprint to actually begin tackling these health disparities at the organizational and community levels. And to tell us more about that, actually, we're going to bring my dear colleague Brenda Cruz back to take us through CLAS.
Okay, thank you, Miguel. So we've discussed health disparities and provided you with an overview of health equity to get us all on equal footing. But now we're going to dive deeper into today's topic of focus, which is, are you fostering health equity with CLAS? And for today, CLAS refers to the culturally and linguistically appropriate standards developed by the U.S. Department of Human Services, Office of Minority Health. So really quickly, in the chat box, I want you to tell me, what barriers do you see in delivering culturally and linguistically competent care and services in your community? Share with us what those barriers are and what are the barriers that you're seeing. I'm going to give you one moment to do that. A lot of, okay, Ms. Alexandra, could you be a little more specific? Yes. Language access, money and resources, yes. Okay. You can keep them coming. Language, lack of opportunities for leadership for people of color. Yes, these are all barriers. Well, CLAS is a strategy to reach health equity by tackling all of these barriers. So we always say that talking about health equity, well, we always say, meaning we here at the office, that talking about health equity is similar to talking about world peace. It can be overwhelming and abstract, but the National CLAS Standards provide specific assistance on how organizations and healthcare providers can address health disparities to improve overall quality of services. Okay, so the National CLAS Standards are intended to advance equity, improve quality, and help eliminate healthcare disparities by establishing a blueprint, literally a blueprint, for healthcare and healthcare organizations. While we can't immediately make changes that can transform and improve right this second the issues that Miguel reviewed earlier, we can, however, modify the lack of culturally and linguistically appropriate services and ensure that care and services are provided respectfully and responsibly to the cultural and linguistic needs of all individuals that walk through our doors in our organizations. And we can start to do that right now. Culturally and linguistically appropriate services are more and more recognized as effective in improving the quality of healthcare and healthcare services. So by providing a structure to implement culturally and linguistically appropriate services, the National CLAS Standards will improve your organization's ability to address healthcare disparities and increase health equity. CLAS aligns with the Health and Human Services Action Plan to reduce racial and ethnic health disparities and the National Stakeholder Strategy for Achieving Health Equity, which aim to promote health equity through providing clear plans and strategies to guide collaborative efforts that address racial and ethnic health disparities across the country. So if you are prioritizing the advantage of health equity in your organization and in your community, we recommend that you start with learning about and operationalizing the National CLAS Standards. So the enhanced National CLAS Standards were developed from the original National CLAS Standards in 2000 by the U.S. Department of Health and Human Services, Office of Minority Health. The original National CLAS Standards provided guidance on cultural and linguistic competency with the ultimate goal of reducing racial and ethnic healthcare disparities. The Office of Minority Health took on the National CLAS Standards Enhancement Initiative from 2010 through 2012 to revise and update the standards and recognize the increasing diversity and changes in the fields of cultural and linguistic competency and to ensure relevance with new national policies and legislation such as the Affordable Care Act. The enhanced National CLAS Standards, completed in 2012, incorporate broader definitions of culture and health and aim to reach a broader audience in an effort to ensure that every individual has the opportunity to receive culturally and linguistically appropriate healthcare and services. Without going into too much detail, the Blueprint offers user-friendly format for providing comprehensive information on each standard and can be really useful to organizations. The Blueprint is a great implementation manual. It's one of the documents on your materials page. You should have a bar in your console that says materials, and if you click there, it's one of the documents we have uploaded for you. The Blueprint dedicates one chapter to each of the 15 standards. These chapters review the standard's purpose, components, and strategies, which is a key importance to you. And in addition, each chapter provides a list of resources that provide additional information and guidance on that standard. So that's really a blueprint. But before we go into the standards themselves, we need to discuss another aspect of CLAS, the business side and the return on investment. For executive level management, it's always important to view any organizational investment from all sides, from the benefits to the community and clients to the bottom line. How is this also going to improve our organization in the business sense, you will ask? And here it is. Here is the list of returns. Implementing CLAS will give your organization a competitive advantage over organizations providing similar services but who are not prioritizing health equity. You may ask, however, we want you to consider this to prove it. By implementing CLAS, you're going to develop a more loyal and responsive client base and also a stronger and more positive reputation in your community. You're going to recruit and retain more clients. More individuals will be able to access your services. Your levels of services will increase because you will be meeting or exceeding your target numbers, and you know how funders love that. Also, since you will be involving and listening to your community more, your services will be more customized and perhaps even more cost-effective. Your clinicians will be communicating better and more clearly with the clients, and in return, there will be less treatment errors and an increased understanding between clinicians and clients. This also means that you will have a stronger story to tell when you identify and apply for additional funding and grants to sustain your programs or even add services. These are just some of the examples of the return on investment for implementing CLAS that your organization can count on seeing. So if this sounds good to you so far, I want you to type yes in the chat box. Great. So now we're going to go over the standards briefly. But first, I also want to ask you, who is already using CLAS in their organizations? Thank you for all the yeses. That's really a great feedback. So if you're already using CLAS, type CLAS so that I know the distinction. The yes is for, you're getting it, and the CLAS is for you're using CLAS now. Okay, great. So there are a total of 15 standards. I'm not going to read each standard. That you can do on your own at your leisure. What I will share with you in these next few slides are what the standards refer to and what questions you need to be asking about your organizations that are related to the theme. The principal standard, as you see here, is the gold standard. The other 14 standards fall into one of the three themes. The first theme 1, is governance, leadership, and workforce, and standards 2 through 4 fall into that theme. The second theme is communication and language assistance. Standards 5 through 8 fall in theme 2. And the third theme is engagement, continuous improvement, and accountability. And standards 9 through 15 fall into that theme. Now would be a good time to retrieve the handout page with the 15 standards that you may have. It's also available in the materials bar. You could click on the link and that'll take you to the 15 standards. I'm going to go ahead and give you a moment to do that. Okay, theme one covers the standards related to governance, leadership, and workforce. This area emphasizes the importance of CLAS implementation as a systemic responsibility, requiring the endorsement and investment of leadership and the support and training of all individuals within an organization. Standards 2 through 4 encompasses organizational policies, staffing patterns, and investment in employees and volunteers who work within an organization. In this theme, let me go back one. In this theme, you want to make sure that your organization's policies are aligned with your programs and services and your populations of focus. You want to ask questions like, how does the staff reflect our target populations beyond race and ethnicity? Does our organization's policies ensure that the staff receive adequate professional development about advances in the field of public health, emerging populations, and groups and other issues related to primary health and health equity? Theme 2 covers the standards related to communication and language assistance. This area encompasses all communications needs and services. We're talking sign language, braille, oral interpretation, and written translation. Here's where standards 5 through 8 fit in, and it entails informing clients of language assistance services that your organization offers for persons with limited English proficiency and providing those services with trained professionals. It also encompasses any print and multimedia. Here you want to know how your organization displays its policies, pictures, and other types of communication that create a welcoming environment for the target population. Here you can also examine what your organizational processes or policies, which of those are in place to guide your social media outreach and marketing. Your cyber presence also has to encompass the CLAS standards. An activity that POSI does that is directly related to this theme is the walkthrough. We also recommend that organizations conduct a walkthrough to assess your organization, its facility, the entrance, the receiving areas or waiting areas. So some of these images that you see here on this slide are from our organization, POSI, and we periodically conduct this type of walkthrough. Focusing on the picture on the left, you will see what people see when they walk in our doors. You will see images, a nice clean environment, appropriate signage. Our receptionist on the right is trained to greet all clients, and also to greet clients with limited English proficiency. You want to ask yourself, do you have signage in the dominant languages of the major groups in your service area? You want to pay close attention to your art and images. You want it to be inclusive. You want to make sure that you have private counseling areas. So if you see the third picture on the top, all the way to the right, that's our waiting area, and you will see that door. That door is one of our private counseling rooms. So you want to make sure that staff have been trained not to have client conversations about matters and services in public spaces. So conducting this type of exercise will tell you a lot about your organization and how the community may see it, and it is directly related to CLAS Theme 2. Moving along to Theme 3. Theme 3 covers the standards related to engagement, continuous quality assurance, and accountability. This area underscores the importance of establishing responsibility for ensuring that CLAS is supported across your organization. This includes internal policies and processes that reflect a culturally competent approach, ongoing organizational assessments, input from your community, data collection, and service delivery. And here, the standards 9 through 15 fall into this theme as well. In going through these themes, what I used to ask these questions is an organizational assessment that we created, a tool. We call it the Organizational Assessment for CLAS, that is also uploaded in the materials toolbar. It has these questions that you can ask yourself about your organization to make sure that all of your services and that your organization is in line with the CLAS themes. The assessment asks key open-ended questions of organizational practices as it pertains to cultural and linguistic competence. And as I said, they're all organized under themes. So our suggestion is that you go through the assessment and see where your agency falls in general and with regard to a specific population or group to see where your agency stands. So now that we have reviewed somewhat the CLAS standards, you will meet our guest from our featured organization, the North Jersey Community Research Initiative, Mr. Christian Mendez, who is the program manager of Project WOW, located here in Newark, New Jersey. I'm going to take a moment and I'm going to unmute Christian's line so that we can hear him speak. So Christian, your line is open. So Christian, I want to thank you so much for joining us today. We are privileged to have you collaborate with us, as NJCRI often does, and share with our attendees what NJCRI is doing to reduce health disparities in Northern New Jersey and in Newark, New Jersey. Christian, I want you to start off by telling us a bit about NJCRI and what NJCRI is doing to reduce health disparities.
Good afternoon, everyone, and thank you so much for having me representing my agency. So I will go right away with what NJCRI is, a little history of it. NJCRI was founded in 1988, and the whole purpose of it was to go ahead and deal with those who at the moment were diagnosed with HIV/AIDS under the wing of Dr. Sorry about that. Someone's coming in. We were pretty much focused on the HIV care and treatment. At the moment, right now, 31 years ago, NJCRI is pretty much leading in many ways, when it comes to healthcare. And when I talk about healthcare, I want you guys to think also not only about HIV care and treatment, but healthcare in general. And regardless of your gender, regardless of your race, regardless of any other demographic, we are here to provide quality when it comes to healthcare.
Thank you so much. Thank you so much, Christian. So now I'm going to ask Mr. Mendez a couple of questions that are specifically tied to the CLAS standards to demonstrate how NJCRI is operationalizing CLAS. I'm going to move to the next slide so that we can see the questions. Okay, so the first question is directly tied to theme 1 related to governance, leadership, and workforce. How does NJCRI staff reflect their target populations beyond the basic demographics of race and ethnicity? Christian?
Well, it starts with the recruitment. We at NJCRI take pride in recruiting within the community. That way, the community can have trust in us because we are actually knowing the person that we're recruiting. They're part of the community. They come to our NJCRI. They're part of our vast majority of, regardless of, again, demographic and ethnicity, they're within the community. So therefore, people that come over here for care, for treatment, for services, they see themselves in there, they recognize them, and they feel comfortable coming into NJCRI because they know, I feel how I see someone out there. It's more inviting if you have someone that looks like you, someone that talks like you, someone that might come from within your country, someone that actually comes with and from your community.
Thank you so much. Okay, so now we're going to move to the next question, which is directly related to communication and language assistance. How does NJCRI communicate a welcoming, receptive, and open environment to your clients, to its clients?
As you come for the first time for NJCRI, as soon as you open the door, you're going to be greeted with a welcome, a happy face, a smile. And as you're walking in, you're going to find out that we have a resource table there with all kinds of information, different language. And, as you look around the whole lobby, the first floor lobby, you're going to see that there's some posting regarding the services that we provide, as well as the other agencies that we collaborate with them. And again, focus on language, focus on the different language that our client might speak. And also, we have our TV that is constantly showing the different services that we provide, again, in multiple languages up there, with pictures that represent something to our clients, something that make them feel comfortable with. It's very important, the welcoming part of it. It's very important to have someone that the client or patient can relate to, someone that is respectful to them, someone that is able to, not only develop that relationship of sympathy, but more about empathy. Someone that, regardless of your condition, regardless of the struggles,
Yeah.
is able to, to see you as you are, a human being, and that you're here, and I'm here for you to provide you with a service, the best quality of service.
Yes, I can. As you were speaking, Christian, I could see myself walking in as a new client, and I pictured the TV with all of the services. I pictured the signage with the language, and the staff people that are there welcoming with open arms that really look and reflect who I am. So it sounds like you are definitely creating an open and receptive and welcoming environment to your clients. So great. So the next, which is what theme two is all about, one of the standards within theme two. So the next question is related to theme three, which is engagement, continuous improvement, and accountability. So Christian, tell me, how does NJCRI build coalitions with community partners to increase reach and impact and create a system of care that is accessible, equitable, and of quality?
Well, NJCRI was pretty much born within the community, listening to the voices of the community. So once you give that to them, to each and every single member of the community, that you can come over here and I'll be listening to what you have to say, and based on what you have to say, based on the needs that you're actually explaining us, then we're going to navigate that system, the health system, to provide you exactly what you need. So we're constantly doing outreach in terms of the community. We are very close to our outreach people, to our gatekeepers of the community, along also with the advisory board. Um, Part of NJCRI, we do have our board, and that board it has a very tight and close relationship with the community because it is made out of members from it. Every single department, every single program that we have here, especially the one that I get to manage, has within his foundation a core group, and that core group is made out of the members from the community. We sit down with them and we listen to what they have to say, where they want to be taking care of their health. Again, health is something that is constantly evolving, and if we're working with having in mind and taking care of diversity and inclusion, we definitely need to pay attention and close mind to what exactly is that at the moment our community needs in order to continue providing that quality of care. That develops kind of that relationship and that trust. Once you have the trust of the community, once the community is able to let you know and refer clients to you because obviously they feel that you are there, that you're listening, that you will move any obstacles that is there in order to get to them. They will keep on that relationship. It's a dual relationship in which not only NJCRI benefits, the clients benefit, and the community is able to grow and continue
Yes.
the services. But we can never do that without our partnership with all the other allies that we have around here. It is very important for NJCRI, it's vital for our community to have partnership with the different agencies around. We're able to refer within our agency. Let's just say we have programs dedicated for gynecology, also obstetrics. We also have pediatrics, CTR. We also have substance use behavioral health. But there's times that we need to refer, and we need to have people that we, have developed that relationship, people that we trust, and also that the community trusts. And therefore, around the area of Newark, we have Proceed, we have La Casa de Don Pedro. We definitely have worked closely with Rutgers and with San Michael's, and we also work very closely with religious agencies and partners because they are a great assets to us. We have a very religious-based community, so we have to utilize them in the best way to serve our community.
Yes. Well, it definitely seems to me from what you have been describing that NJCRI is a one-stop shop, an organization that has a full menu of comprehensive services, but you still realize that you don't have you can't meet every single person's every need. So you still
Right.
have a process for making referrals. I like that you shared that you have so many different ways in which you engage the community and you listen to the community through your board involvement, through having individuals from the community participate in different boards, program boards. So it seems to me that you're doing a lot of assessments, which is great. You're really taking all of that information to help you design your programs. And just as you said earlier, how the NJCRI was focused more on providing services for HIV prevention, but now you have all of these different services, and that has grown and developed from assessments and from listening to your community. And also, thank you for sharing all of the information about the partnerships and collaborations, because all of that adds value to all of the services. And hopefully, those strong collaborations will show individuals that people and community members are entrusted and that you are able to serve them well. So thank you so much for providing that information. Okay, so I have a note here. Says, okay, Dr. Giselle Pemberton, who's our director, just added a comment to the chat box about all of the different wraparound services, yes, that NJCRI has. And so, we're lucky to have you in North Jersey to providing all of those services. But as from what you said, it has evolved. 30 years of service, that's a long time. And I'm sure your organization looks very different now than it did 30 years ago, correct?
Yes. So right now
Mm-hmm.
we're moving into our 31st anniversary. And again, evolving takes the ear, let's just say it like that, from the community. Evolving is something constantly within the human nature, so therefore we need to continue the changes. But those changes need to be taken care in consideration based on, like I'm going to say it again, our community. It is only what benefits them. It's where they're going that we should be going. It's not imposing what we think. It's more about listening to what they have to say. And collaboration with other agencies is vital for it. One of the things that I enjoy about working at NJCRI in the Newark area is how we are all a family. There's things that, in a way, we know our limitations, but that limitation becomes unexistent once every single entity, every single agency is collaborating together. But I'm going to bring out now Pride Month. Um, it's something that is happening. It is beautiful to see the enthusiasm, the motivation of the whole community joining all together to provide a service.
Thank you so much, Christian, for being our. This is great. Um, they're doing such a great job, but I want to thank you for being our guest speaker today and sharing some of what NJCR is doing to reduce health disparities. But I want to give the group. I want to give first of all, let's give Christian Mendez a virtual round of applause. So if you could just type applause, because that was great. Thank you so much. Um, great, great. Let's give him an applause. So I want to give the group, our attendees, an opportunity to ask Mr. Christian Mendez any questions that you may have. So I know that I already have one question that I did see typed. Let me just go scroll past all of the applauses that he received. And the question from Mr. Kevin Sitter is from California. Did NJCRI become an SQHC?
Yes, it did.
Okay, so NJCRI is an SQHC. What other questions? And we all know that that's a process, and you do have to meet specific criteria. So I'm sure they had to go through many different assessments and to check to make sure that they met all of the criteria. But what other questions do you have for Mr. Mendez? And you can type them. Well, actually, it's best if you type them for us. We're going to give you another opportunity at the end to ask questions again. But if I don't have any immediate question right now, then I'm going to go ahead and continue. So, Christian, we're going to open up your lines back again a little later, but for now, I'm going to mute your line, which I just did, and I do want to go ahead and summarize this section. And so let's take a couple of, like I said, to summarize this section. I will review some key pointers for you to keep in mind as you embark on your journey to advance health equity in your communities, starting from within your organization. So it's so important to continually assess your organization and address any issues that are identified or trends that are emerging. Always have your rapid action plan, what you will do immediately and what you will complete over a period of time. Invest in your staff and use performance appraisals as opportunities to help your staff grow. Don't overlook appropriate signage and any print messages that you have throughout your organization. Review them on a regular basis and replace them as necessary. Don't ignore your internet presence. Everyone is using their cell phones to read reviews, to check out organizations. So it's important to really remember your cyber presence. Collect the data that you know you will use later for reporting, for storytelling, and for any change management. Don't collect data that you don't think you'll use. Remember, work smart. Review organizational policies often. Are they aligned with CLAS? Do they serve your populations well? Always monitor, evaluate, and improve. It's the only way to keep the competitive advantage that you want to keep. Include your community members and your target groups through advisory boards and steering committees. And repeat the process over and over again. You should view it as a cycle to be repeated on a regular basis. So now I'm going to turn it over to Miguel. Miguel is going to go over 2 recommended resources that you may want to consider using to start you off in making some immediate changes to address health equity. He will also be taking us through the end of the session. Miguel?
Oh, thank you so much, Brenda. And again, Mr. Mendez, thank you so much for taking the time to share the experience of your organization with us and all the wonderful work that you do. I really want to share these 2 tools with you. We love them because they're straightforward and they get you to action right away. So we'll start with an implementation checklist for the National CLAS Standards. And in order to make this a little bit, I want to say a little bit more relatable, we decided to create a fake organization, and it's based on Game of Thrones. So this guide will actually get you started. And we begin with who's filling it out. In this case, it's Sansa Stark, Queen in the North. She's part of the Stark family. So that's just to show you that doesn't matter. So we get instruction and guidance on how to complete this, and it's based on the themes. For the purposes of this session and the time that we have left, I will focus on theme 1, which pertains to governance, leadership, and workforce. And basically, here, this fake organization identified either elements or areas in which, or practices in which they're actually currently implementing, planning to implement, or not planning to implement at this time. So we have those 3 columns, and let me give you just an example. Identify and designate a CLAS champion or champions for your organization. They selected this as one of the areas that they're planning to implement. They're not currently implementing that, but they're all doing all the things related to CLAS. For instance, 1.2b, they're already working on creating and implementing a formal CLAS implementation plan. They selected here that they target recruitment efforts to the population they served to increase recruitment of culturally and linguistically diverse individuals. They're doing that. However, I'm most interested in the areas where they're planning to go next. And some of these are, for instance, creating an internal organizational mentorship program, deliver and make freely available continuous class-related training and technical assistance. And I'm going to leave it until there. and then show you as you go through the section and you fill out things either you're working on, you plan to work on, or you're not considering at the moment. As you move along, you fill out the three segments. But like I said, for this presentation, I'm going to focus on the first one. And at the end of the form of this checklist, what you find is that the areas that you identified as planning to implement become part of your action plan worksheet. So now you give yourself a time frame, let's say by September 1st, identify and designate 3 class champions. Number 2, by December 15th, create an internal organizational mentorship program. And by March 30th, 2020, deliver the continuous class-related trainings and technical assistance to the leadership and staff. When you do that, you know what you need to tackle. And then it guides you through the process. And what you're going to do then is look at how are you going to execute that. Because planning is, as I like to say, beautiful. But if we have some framework that's guiding us as to exactly what do we need to do next, which is what you get out of this particular instrument. So it tells you at the end, congratulations, you now have a class implementation action plan. And you just began with this. It's really straightforward, like I said, simple to do. And honestly, it's a great tool to have. Now, let's say you find yourself in a situation where you don't have clear ideas as to what the strategies need to be or ideas for that. That's where our next tool comes into play. Let me just go back here and show you. If you look at if you look at the National Standards for Culturally and Linguistically Appropriate Services in Healthcare, this is the actual blueprint. The blueprint doesn't leave you alone. Since this fictitious organization selected strategies related to theme 1, here you have a list of suggestions that you can follow, strategies that you can use, but also, what if you say, oh my God, I want to implement this, but are there resources out there that I can use? Well, guess what? The blueprint also provides you with an extensive list of resources that you can use, and then you're not lost. So you just started your journey into class, but you have all the tools and materials that you need. So let's continue. Let's briefly give you another opportunity in case you have any questions left. Please put them in the chat box. I know that time is of the essence, but we don't want to leave those questions without giving it the proper attention. So please, if you have any questions, I'm going to give you a few seconds to put them in.
Yes.
Yes, go ahead. Tell us if you have a question and we can go. I also don't want to forget, while you think about your question, our very own CLAS in Action Implementation Toolkit, which if you look under materials, you will find that we believe that that's an essential toolkit to have, and it will really help you turn CLAS from theory to practice. So you can definitely make use of that. We did that thinking of you. So please take a look and see how you can actually take the CLAS standards for a spin and make them happen at your organization. So with no further questions, let's continue with the program as we are nearing the finish line.
Okay, yes. I just want to say that, yes, the slides, please remember that the presentation is loaded in the materials toolbar that on your console. So we have uploaded about 8 different handouts and tools, and there's a couple of links in there too, as well, for you to use some of the resources. Our own organizational assessment tool is there as well. So please review. You will also be receiving a follow-up email tomorrow, which I believe you will still be able to access these materials in the follow-up email that you will get through GoTo training from Proceeds. So just in case you forget or don't get a chance to download these. Tomorrow you will get another email.
I really wanted, before the session is over, to share with you what's coming from our program because we have more things coming, and I'm going to share that with you. This is part of a series.
Yes, but before we go to the series, Miguel, we have a question, and I do want to, since we're still in the question
Sure,
and answer,
go ahead. Let's do
I want to
this.
read the question. What metrics or tools do you utilize to measure whether your strategies to incorporate CLAS are effective or not? In particular, what steps have been taken to measure equity, and do you have measurable results that you could share? I struggle with moving beyond increasing awareness, taking steps to change, and then having tangible results that show we have become more culturally competent, equitable, yes, increased access, etc. Okay, well, off the top of my head, I'm going to say that it really goes back to your clients and your target populations. Are they feeling, are you seeing that your numbers are increasing? So, you compare established baseline metrics and then perhaps conduct a focus group with your population as also collect baseline information, and then maybe over a period of a year really implement those changes, and then go back and reach out and assess your clients and your groups once again. Look at what programs have been changed, added, the levels of service. That, off the top of my head, those are just some ideas that I have to really measure any kind of changes. But I want to open it up to the group as well. Any organizations that have undergone a change management, what have you done to really track your changes and to really assess any kind of improvements? Please type that in. So we have someone here that says CLAS standards have been institutionalized into our organization and all of our subrecipients. Implementation of the policy is the tricky part for us. People tend to fall back on the minimum requirements, of the policy, such as language access, phone line instead of a paid staff person who speaks Spanish. So any ideas of how to elevate this instead of seeing it as a box to check? Yes, that does happen. Here we go. Giselle Pember, a health equity strategic plan with, right. So really, that's real. If your organization is really serious about this, you would consider creating a health equity strategic plan with baseline information and then projections. Now, if you meet those projections, then you know that you are making progress and that you are definitely making improvements. So if you project and meet, then that's something really tangible and concrete because you have that documentation. So our data collection tools should not force someone to answer white as a race for Hispanics. I totally agree with that. Myself being a Latina, I struggle with that question on those forums all of the time. And, what is the answer? I'm not sure. But we need to keep bringing it to the attention, bringing it up is definitely something that we need to do. And if people have suggestions, they really need to be bringing those suggestions to the table. I totally agree.
We've had fantastic feedback from
Thank you.
These
are, we don't have all of the answers, but we hope that today's session provided you with some tools.
But you know what? Like I was trying to say earlier, this is not over. We can still continue our interactions, and that brings me back. This is number 1 of 3. So we have 2 more webinars coming in, and we will continue to go deeper into topics related to health equity. So as a matter of fact, the next session is scheduled for July 17th, 2 p.m. Eastern again, and the title of that is Steps to Advancing Health Equity and Reducing Disparities. It's like the follow-up to this initial conversation, and we will sure miss you if you don't show up next time so that we can continue the conversation. But that's not all. We will have a third one which actually will be about developing strategic alliances to achieve health equity because we cannot do this alone. It requires developing partnerships to push this ideal. Oh, we're being invited to Chicago, basically. Well, thank you. Um, so those are two things that we have coming, but that's not all. We actually have another event coming up.
Yes, and Ms. Arjona, we struggle with this. When we do two-hour sessions, we get feedback that our sessions need to be more brief, and when we do an hour session, we're trying to. This is just a taste, but we will soon begin our program year 2, and we will be offering more webinars on this topic. And so we hope that you will continue to participate in our future sessions.
But do we have anything else coming up, Brenda? Oh, look. So we are actually working on putting together this wonderful event in Puerto Rico because just as actually I believe it was Amanda who was pointing out that what do we do when we are forced to put that we're white on our forms? Well, we're coming to Puerto Rico to actually address issues related to class and related to health equity in the island because many times a lot of things that are happening don't get any attention, and we know that there are people doing work. So we want to bring folks who are interested in advancing health equity in Puerto Rico together during that one-day event. So we definitely look forward to an amazing event in Puerto Rico. Every time we go down there, things are fantastic, and we don't expect anything less than that this time around. So those are the three upcoming events which we want to see you on the next couple for sure. Let's continue the conversation about health equity and not only talk about disparities, but what can we do to address those disparities effectively. We're here, so this is how to get in touch with us. Let's say you needed or wanted technical assistance. You can definitely reach out to us. The information is actually in the materials as well. But guess what? We really need to ask you for another favor, and that's related to we really need to get feedback from you.
Mm-hmm.
And at the end of the session, there's going to be a very brief but very informative evaluation form that we need to hear from you. So please fill that out, and we'll be doing.
Yes, and if you're interested in receiving individualized capacity building assistance, please contact us and we can assist you further. I put it in the chat box, but I'm going to remind you again that if you are participating as part of a group, please send us a quick chat telling us how many people are in your group and the name of your organization so that we have accurate figures. And I'm sorry this went over just a couple of moments, but thank you so much for hanging in there with us and sticking with us to learn more about health equity and cultural competence and how to use CLAS. So find us on social media, use our Proceed FIBA for Equity, and thank you so much. If you have any other questions, we'll be on the line for a couple of more moments. You can ask us, or you can email us directly. But remember, the presentation is downloadable, and we're hoping to keep in contact with you. And please register for the other sessions. Miguel, Christian, I'm going to open Christian's line quickly to see if he wants to just say goodbye and any closing comments. Christian, your line is open.
I just want to add, thank you so much for this. Thank you so much for everyone just, listening to this great conversation, and that I'm looking forward for more of CLAS and learning more and how all together we can definitely come in, and do something in terms of our community, in terms of the healthcare that they deserve. And hey, if you need any help, let me know, and I'll ship down to Puerto Rico too. We should have a CLAS 2-day conference.
I saw that recommendation. Well,
we're dreaming about it.
One never knows. Yes, that's a great idea. Thank you, Christian.
Yes,
We're jotting it down.
Thank you so much.
Okay. Let me just close that. Okay, so this officially ends our session for today. And Miss Rivera, of course, how could we be culturally competent and not include the class standards in Spanish? So yes, they are included in one of the links in Spanish. So please use them. And thank you so much. And we'll be in touch. We're signing off. Have a great rest of the day to all of you.